I'm 36 years old and I've been a vet for 13 years. I initially graduated from Bristol and then I went into sort of general practice. After that I got interested in doing surgery. I did a certificate in small animal surgery in 2001 and after that did a bit of travelling, worked as an orthopaedic surgeon for 5 years primarily, and then I took the plunge and became a vet at companion care, and I did that 2 years ago and took over a practice there. I've always had an aspiration to have my own practice. I've always wanted to be my own boss, and I was always aware that running a veterinary practice was a big undertaking for one person, and I did toy with the idea of doing it on my own and going solo, but then I realised that by having the support of companion care in the background to help me out, it was going to be the best way of doing it, and it was going to work and give me a good sort of work-life balance. It's also having the ability to have people that are real experts in their field. So we've got people that are operations experts, we've got marketing experts, HR experts, and you just can't get that from having a small veterinary practice. You just don't get that sort of wide range of abilities to help you out, and they're there if you need them. They're there at the end of the phone. I looked at two options. I looked at buying a practice outright, and I looked at buying into companion care, and I looked in detail at both, and I really just came to the conclusion if I was going to be buying a practice outright, I would be spending an awful lot of time at work. I have a family. I don't want to be working 24/7, quite frankly, and that's the conclusion I came to. One of the misconceptions, I think, is that we're told what we should be using. That's not the case at all. We're really at our liberty to use things which we think are appropriate, medicines or treatments. Obviously, there are huge benefits from being within companion care, so we do get some discounts that are as a group, and you'd be crazy not to take those on board in terms of vaccines and medicinal products and that sort of thing. But if you have strong views that you want to use something else, then that's up to you as a practice director. I've been quite surprised by the level of business acumen. I obviously knew I was coming into a company that was growing very quickly, and obviously had their finger on the pulse. But the level of business integrity that I've seen from the companion care services has been really top notch, and the quality of the staff that they're bringing in really superb. Yeah, I think my aspirations are I really enjoy orthopaedics, so I'd like to do more of that and take on more referrals in the future. I'd like to possibly take on another surgery in the future, who knows, and I think maybe even spend a bit more time at home, but I've got the flexibility to do all of that if I want to.